Hello there, I'm Black Bright News, and today's story, I guess, is about the 150,000 vulnerable claimants who face losing benefits. So, this news story caught my attention that impacts disabled people, carers, and those who rely on financial support from the welfare system. More than 150,000 people receiving benefits are expected to be contacted by the Department for Work and Pensions as part of a major reassessment programme. According to reports, claimants identified as vulnerable will be asked to respond to the DWP, and those who fail to do so could see their benefits stopped. Now, on the face of it, some people might think this sounds perfectly reasonable. Governments have a duty to make sure public money is being paid correctly. Benefits are funded by taxpayers, and there is a legitimate expectation that people receiving financial support are entitled to it. Circumstances change. People's health can improve. Their income can change, and from time to time, claims need to be reviewed. Most people would accept that principle, but this story isn't really about whether a reassessment should happen. It's about what happens when the people being reassessed are among the most vulnerable members of society. So, many people claiming disability related benefits live with long term physical illnesses, learning disabilities, serious mental health problems, or cognitive impairments. Some struggle to understand official letters, others rely entirely on family members, carers, or support workers to deal with the paperwork. Some may be in hospital. Others may simply become overwhelmed by anxiety when official correspondence arrives through their letterbox. That is where the concern begins. The warning is that anyone who does not respond could lose their benefits. Now imagine receiving a brown envelope from DWP when you already struggle with severe depression, memory problems, or a learning disability. For many people, that letter is not just another piece of paperwork. It can become a source of fear. Some people worry they might complete the forms incorrectly. Others are frightened of saying the wrong thing. Some delay opening the letter because the stress becomes too much. By the time they feel able to deal with it, deadlines may have already passed. This is something disability charities are highlighting and have been highlighting for years. They say the biggest risk isn't necessarily deliberate fraud. It's people who genuinely qualify support but fall through the cracks because the system is difficult to navigate. Of course, the government would argue that there have to be clear rules. If people don't respond, the DWP has no way of confirming whether their circumstances have changed. Ministers would also point out that most claimants do complete reassessment successfully and that safeguards exist for those who need additional help. From the government's perspective, maintaining confidence in the welfare system depends on making sure support goes to those who continue to meet the criteria. But critics say the language of failure to respond doesn't always tell the whole story. Sometimes people don't respond because they can't, not because they won't. There is a significant difference between refusing to cooperate and being unable to cope. Another concern is trust. For many disabled people, every reassessment brings uncertainty. Even when their condition is permanent or unlikely to improve, they often feel they have to prove their disability over and over again. That repeated scrutiny can take an emotional toll. Some describe living with a constant fear that financial support could disappear, making it difficult to plan for the future or simply to feel secure. There is also the practical reality. For some already managing chronic stress, appointments, medication, and daily living challenges, another assessment can feel like another hurdle rather than another opportunity to receive support. Support organisations are urging anyone who receives correspondence from the DWP not to ignore it. If someone is struggling, they should seek help as early as possible from a family member, trusted friend, welfare advisor, or advice organisation rather than waiting until deadlines have passed. That's easier said than done, though, isn't it? We know of people who have died alone. What about that woman who starved to death? You know, people struggle with mental problems. Some people they live in a accommodation where they're hoarding. They don't even look at letters. Doesn't mean that they don't need help. And you know, trusted friends, welfare advisor, advice organization. How do these people, they make it sound so simple, as though you could just, everybody has friends, everybody has a welfare advisor, everybody can go to an advice organization. These days, I can't tell when last I saw a physical citizens advice building. And then when you try to phone, you can't get through. It's all press 1, press 2, press 3. Anyway, early support can often prevent much bigger problems later on. Ultimately, this story raises a wider question about how society treats vulnerability. How do we strike the right balance between protecting public money and protecting people who genuinely need support? Can the welfare system be robust enough to prevent abuse while also being compassionate enough to recognise that some claimants need additional help simply to engage with the process? And that's another thing. Compassion. We're dealing with machines, we're dealing with IT, we're dealing with algorithms. We're not dealing so much with people anymore. Those are difficult questions and there is no easy answer. Some people would agree that fraud should be tackled. Most people would agree that genuine, vulnerable people should not lose essential income because they were unable rather than unwilling to respond to official correspondence. As this reassessment programme gathers pace, many people will be watching closely to see how many cases are reviewed. As this reassessment programme gathers pace, many people will be watching closely to see not only how many cases are reviewed, but how the process is carried out and whether the safeguards are strong enough to protect those who are most at risk. I'd be interested to hear your thoughts. Do you think the current reassessment process strikes the right balance between protecting taxpayers' money and protecting vulnerable claimants? Or do you think more safeguards are needed before someone's benefits can be stopped? Let us know what you think in the comment. I remember reading one of these cases where the person who they'd sent letters to them, and I think they'd stopped their benefits. But the person was not only ill, but I think they'd been in hospital for months. And, you know, the systems don't seem to capture, they don't seem, oh, we haven't had a response from this person. Let's go and send a health worker or an assistant round to make sure they're alive, to make sure they are okay. There is nothing in place for that. It is assumed that if somebody doesn't respond, it's because of something sinister. And we live in a society where people just don't trust anyone anymore. Everybody thinks that, well, not everybody, but a lot of people think that people are trying to pull a fast one on the system. They tend to have this mindset that, oh, if they haven't responded, that means they're hiding something. They don't want to submit the paperwork. Or, you know, there's something dodgy going on. Otherwise, why not respond? There's nothing to stop them from responding. There must be someone who can help them. Often there isn't anyone to help people. We live in a world, especially since COVID, where people are isolated, where people have mental problems, where people cannot cope. And to say that you're going to stop income just because they haven't responded is, in my humble opinion, only my opinion, unfair unless further investigations have been made. Anyway, passionate subject, I know, and I'm Black Bite News. I'd like to hear your comments about this because we all know somebody who's vulnerable, don't we? And we wouldn't like to see them go without unnecessarily. And that's all I can say for now. Take care now. Bye bye.